Arrhythmias are abnormal heartbeats, and the sequence of electrical impulses are going to be abnormal and cause abnormal heart rhythms. Some arrhythmias may act briefly and may cause a temporary pause or premature heartbeat. This means they're normally harmless. However, if the arrhythmia lasts for a significant period of time, they may cause the heart rate to be too slow or too fast, or may affect the heart rhythm to be too erratic. This makes the heart pump less effectively. When the heart doesn't pump blood effectively, the brain, lungs, kidneys, and other organs can't work properly and may shut down or be damaged. So on the bottom left, I'm going to put the normal sinus rhythm on, and I'm also going to put an atrial fibrillation strip from an EKG. That way I'm always able to recall what atrial fibrillation looks like on an EKG strip. For rate of arrhythmia, we're going to define two basic terms. First is tachycardia, and this is a fast heart rate in adults that exceeds over 100 beats per minute. A typical heartbeat may range between 60 to 100 beats per minute. The second terminology is bradycardia, which will be defined as a slow heart rate that is less than 60 beats per minute. As for the rhythm, just keep in mind that the patient may have a regular or irregular pattern. Atrial fibrillation is the most frequently encountered cardiac arrhythmia, and it becomes more common as people age. AFib is associated with the heightened risk of thromboembolism such as a stroke and other cardiovascular events that puts a patient at a substantially increased risk of morbidity and mortality. The reason why I mention stroke now is because in atrial fibrillation, the upper chambers of the heart beat irregularly, almost like a quiver, and this doesn't allow the ventricles to fill properly with blood. If a blood clot enters the bloodstream and lodges in an artery leading to the brain, the patient will experience a stroke. About 15 to 20% of people who have strokes have this heart arrhythmia. Patients are also placed on blood thinners because of the blood clot risk, but these medications will be covered in a separate video. Risk factors for atrial fibrillation may develop in patients with a history of heart failure or a myocardial infarction, MI. This is another term for heart attack. AFib is also found in patients with heart valve disease, endocarditis, which is an inflamed myocardium, previous heart surgery, hypertension, or diabetes. Lung complications may also affect the heart. That's why atrial fibrillation often appears in chronic lung disease such as chronic obstructive pulmonary disease, or COPD. The gender of the patient may affect the odds of developing atrial fibrillation, with men being more than likely than women to develop AFib. However, women diagnosed with atrial fibrillation carry a long-term risk of premature death. There are different types of AFib. I'm going to mention three. Paroxysmal AFib terminates within a 7-day time span. Persistent atrial fibrillation lasts longer than 7 days or is terminated pharmacologically or electrically. And permanent AFib doesn't end with cardioversion attempts. The reason why it's important to identify the type of AFib is because they are managed differently. Patients diagnosed with permanent AFib are at higher risk for adverse events. For the clinical presentation, symptoms of an atrial fibrillation patient will be a rapid heart rate, tachycardia. Palpitations, which is an abnormality of the heartbeat characterized by awareness of cardiac muscle contractions in the chest. These contractions may be hard, fast, or irregular beats. This worsens symptoms of heart failure. And as a reminder, heart failure patients may be asymptomatic. In some cases, the patient might experience mild to severe symptoms that may be constant or infrequent. So remember that heart failure patients will experience congested lungs. This means the lungs will fill with fluid, resulting in shortness of breath, dry cough, or wheezing. Heart failure patients also experience fluid and water retention, which results from reduced blood supply to their kidneys. In turn, this leads to swollen ankles, legs, and abdomen. They may also experience weight gain, increased frequency of urination at night, and even loss of appetite. Clinical signs of atrial fibrillation may be an irregular pulse and or an embolic stroke, sometimes called a brain attack. Stroke symptoms primarily affect body parts that the brain controls, and the important symptoms may be recalled with the mnemonic FAST. This is important because it will help detect and enhance responsiveness to the needs of a person having a stroke. The acronym stands for facial drooping, arm weakness, speech difficulties, and time to call an emergency services. Paralysis, numbness, or weakness in the arms, face, or leg will be dominant on one side of the body. As they say, time is brain, so every minute delayed of therapy is millions to millions of brain cells that become damaged. This will highly dictate how well the patient recovers, and in worst case scenarios, if the patient even has a chance at all for recovery. The patient will be placed on an EKG in order to confirm atrial fibrillation diagnosis. For atrial fibrillation, there will be an absence of the P waves and an irregular pattern of the QRX complexes, which I'll go into in another video.